This is Dr. Craig McInnes, and I'm presenting a video blog series about veterinary cardiac ultrasound. I hope you learned something. As veterinarians, we use cardiac ultrasound as an imaging tool for diagnosing and staging cardiac disease. We use a number of standard cardiac ultrasound views to make observations and measurements to determine cardiac function, dysfunction, and cardiac remodeling. The information gathered allows us to diagnose and formulate or adjust treatment for the individual patient. My general cardiac exam educational videos show you how to obtain standard cardiac ultrasound views and how to make standard measurements. The purpose of this series of video blogs is to help the beginner recognize cardiac anatomy as displayed on the ultrasound screen and to interpret a likely meaning for what is seen. I make subjective observations. What do I see? What does it mean? You should be asking yourself the same questions. The purpose of making objective measurements is to support or refute my initial observations. Beginning with two-dimensional cardiac image of the left ventricle in the right side short axis view. In this still image is a right side short axis view of the left ventricle. The right ventricle and right ventricular free wall are also visible and should be evaluated. Note the left and right ventricles. There are no normal measurement tables for the right ventricular chamber size. In general, the right ventricle is about half the size of the normal left ventricle. Note that papillary muscles extend from the left and right ventricular free walls into the left and right ventricles. The papillary muscles connect to chordae tendineae, which attach to the leaflets of the mitral and tricuspid valves to prevent these valves from prolapsing during ventricular systole. Observe the left ventricular free wall, the interventricular septum, and the right ventricular free wall. Note, there are no normal tables of measurement for right ventricular free wall thickness. In general, the right ventricular free wall is about half the thickness of the normal intraventricular septum. Sometimes it is obvious from the two-dimensional image that the left ventricle is larger than normal and the muscle is thinner than normal. Sometimes it is obvious from the two-dimensional image that the left ventricle is smaller than normal and the muscle is thicker than normal. Sometimes it is obvious that the right ventricular chamber is larger than normal and the right ventricular free wall is thicker than normal. At other times, we must depend on the standard measurements from an M-mode view to determine chamber size or muscle thickening or thinning. In this still image, the left ventricular muscle is homogeneous, suggesting it is normal. In this still image, the left ventricular muscle is focally hyperechoic, suggesting infarction, fibrosis, or possible tumor. In this two-dimensional video, The left ventricle appears to contract evenly. In this two-dimensional video, the left ventricular contraction is abnormal or uncoordinated. Muscle of the left ventricular free wall is hyperechoic, suggesting focal infarction or fibrosis of the muscle. The septum is contracting strongly, but the center and right side of the left ventricular free wall do not appear to be contracting. In this video, the left ventricle appears to contract well, but pericardial effusion is present. In this final video, the left ventricle is barely contracting and appears to flutter. My ECG showed this dog is in atrial fibrillation. So when performing cardiac ultrasound, evaluate both video and still images for size, shape, texture, echogenicity, structure, and contractility. The next blog will discuss the right side short axis M-mode view.